Welcome everyone, Adrian Card here from the CFEGA team. I'm pleased to introduce Whitney Pennington, Outreach Coordinator for the High Plains Intermountain Center for Agricultural Health and Safety at Colorado State University, and Bethany Alcalter, Manager of Evaluation and Special Projects at the National Center for Farmworker Health, as our presenters in this session, Keeping Farm Workers COVID Safe. And I'll pass over to our presenters at this time.
Great. Thanks, Adrian. I want to say thank you to Adrian and the planning committee for the conference for having us and inviting us to present on this really important topic this afternoon. So my name is Whitney Pennington, and I'm with High Plains Intermountain Center for Ag Health and Safety, or HICAHS, and we do research and outreach and education programs for keeping agricultural workers safe, and we're based out of Colorado State University. I'm going to pass things off to Bethany, my co-presenter, and she's going to take it from here.
Thank you, Whitney and Adrian. And I am actually a Colorado native, but located in Texas. And the National Center for Farmworker Health, we do a lot of extensive work with migrant and community health centers around the country, as well as other farm workers serving organizations. So thrilled to be here with you guys today. Whitney, could you advance the slide? So today, Whitney and I really want to cover sort of three main topics. And one of those is to help identify some best practices for preventing COVID cases and really for preventing COVID outbreaks among your workforce. And we'll give you some really specific case examples of how that might look on a farm. We also want to help you become more familiar just with the COVID vaccination plan in general and how that's going in Colorado. And we'll also provide you with some resources for how you can implement these best practices on your farm. Whitney, you want to go ahead? So we'll just kind of briefly cover, COVID-19's impact in Colorado. We'll jump into those best practices and those case examples. And then Whitney's going to provide you guys with the vaccine information and resources before we do the Q&A session. Go ahead. Thank you. So I'm sure we're all familiar with, COVID. We can't escape it. It's on the news everywhere right now. Purdue University has estimated that there has been at least 8,000 cases of COVID among ag workers and ag business operators. There's, somewhere between 1,700 and 2,000 new cases a day in Colorado. And there's really increasing concerns about some of these new mutations that are coming out of the UK and Brazil and South Africa. And now in California, there's a highly contagious variant of COVID in that state. And so we're really concerned about that because we know that in ag, we have a very international workforce, we have a very mobile workforce. So if you felt like last year that your ship could have been run a little tighter in terms of implementing COVID safety protocols, now is the time to do it. We all have hope now that the vaccine is here. We're hoping that that will get out, to everybody, especially to ag workers really soon. But in the meantime, we really need to make sure that our protocols are really tight because of all these changes that are happening with COVID. And sort of the last note, just an international note, is that COVID is really hammering right now Mexico and Central America as well. And I saw last week that Mexico's daily deaths due to coronavirus has actually surpassed the daily number in the US, even though they only have about a third of the population. So just keep that in mind, especially if you bring in H2A workers, that we really got to have these protocols in place because it's so prevalent here and in Mexico. Go ahead, Whitney. You can go ahead. All right, so we're going to jump into some tips on best practices right now. And I'm not going to get into every little detail, every protocol that should be implemented. I just want to give you some general advice and then show you some case studies of how that looks in action. So for those of you who don't know, the CDC has a checklist for ag employers, and it's an excellent resource. It really goes through a lot of the steps that need to be taken, a lot of the protocols that need to be in place to make sure that, farm workers are not contracting COVID or that you're not getting outbreaks on your farm. So that link is there. It's also in our handout, and that's a great resource for you to use to, just kind of a place to start thinking about things. If you haven't already. The other thing I really recommend is that a lot of these changes are really hard. You know, there are a lot of work for managers, for crew leaders, and for workers to implement. So as much as you can, involve workers, you know, in the planning, in the implementation, and in getting feedback on all these processes, because the more they're involved, the more buy-in you'll get from everybody, and you need that buy-in for these to be successful. So one way to do that that I really recommend is to form a worker health and safety committee on your farm if you don't already have that established. And what I mean by this is a worker health and safety committee, it really functions best if it's comprised of just workers, non-managerial staff that can really act as your ambassadors, you know, just hour to hour, day to day. And they're the ones that are encouraging their peers to follow these protocols because they know how important they are, and because they often care, you know, maybe they care more about health and safety than some of the other employees or workers do. And then the other thing is just, you know, this is all changing really fast. So obviously you're all connected to an industry association. Make sure that you're reading the news and emails that come through, or from, you know, from other sources like the CDC, just to make sure that you can stay on top of what's happening with COVID, what are the recommendations, and then make sure that information is getting passed along to management and to crew leaders and to your worker health and safety committee. And of course, to all workers when it's appropriate. Go ahead, Whitney. So this, you know, we're about to jump in these case studies, but, you know, farmers are very good at infectious disease control, right? You might be, if you're an animal farmer, you know a lot about biosecurity and quarantine. And if you're a produce farmer, you know a lot about food safety and risk assessment. So I think that a lot of us have this knowledge about infectious disease. It's just sometimes hard to apply it, that type of thinking, to the workforce. But really, a lot of the principles are the same. You just have to factor in this element of people have free will and they have individual rights. So how do we balance, you know, infectious disease control with those individual rights? So, you know, just like you would with food safety, you know, if you have a worker show up to work and they have food poisoning, they might have E. coli, you don't want them working in the packing house that day. So you want to make sure that you have protocol for dealing with COVID or people that have symptoms of it, because it can really be disastrous for productivity if somebody comes to work sick and exposes a bunch of workers. So this list is just some ideas, some start that you want to make sure that you have protocols in place for all of these topics. Go ahead, Whitney. So I have a couple of examples here. And I want to express gratitude to Ag Socio. They're a farm employer that really implemented an amazing set of protocols in COVID safety and stopped several outbreaks from happening when they had a case show up on their farm. And so they shared with us some stories, and I've kind of adapted some of those stories to share with you guys today. And these photos are just examples. They're not from the actual story that I'm talking about. We had one example of a worker that came to work with symptoms. Okay, so this worker showed up to work in the morning. They had a headache. That's a symptom of COVID, potentially. So that worker reported to the crew leader that she had a headache. She had come in the employer provided transportation with 2 other employees. And so that crew leader told her, you 3 got to go right back home. You're going to stay home on paid sick leave until we can get you tested. Okay, so that right there was a good thing, because we've seen a lot of workers feel like they can't say if they have symptoms because they're worried about getting fired, or they're worried about, you know, not getting paid if they get sent home. So they really made sure that the workers knew that we don't want you to come to work sick. We'll cover a couple days wages until you can get tested, just to be on the safe side. So that's what happened there. Whitney, you can go ahead and advance. So the crew leader wanted to keep open communication. They communicated with the whole crew, as a crew of about 30 workers, that an employee, they didn't say who, but an employee had symptoms. And the crew was pretty concerned about that exposure, since they had all been working closely with that woman just the day before. And, you know, people can be infectious 2 or 3 days before they even have symptoms. So the employer worked with the county and the Growers Association and the local migrant health center to arrange for the on-farm testing. And so they did on-farm testing, I believe 2 days later, for the whole crew, just to put everybody's mind at ease. Go ahead, Whitney. So what happened was everybody was negative, including those 3 employees that got sent home. And the employer, wrote it up in an HR incident, and he was also tracking which of his employees were tested and when, and the results of those tests, so that could be really useful in the future in case there was a positive test. All the employees on that crew who got tested were notified via like a mass text message that everybody was negative, and they used that text message to reinforce educational messaging, around wearing a mask, washing your hands, social distancing, etc. And then they also verbally reinforced that information the next day in, like a mini tailgate training with different crews. So this was a really good example of how to manage somebody coming in with symptoms and what to do, because maybe it was a little bit conservative, but I think it was a good balance, because they didn't send the whole crew into quarantine, but they realized that traveling in the shared transportation was a higher risk. They decided to put those 3 into self-isolation until they could be tested, and they went ahead and tested everybody else. So this is a really good example of how to handle a situation like that. Whitney, you want to go ahead? Okay. So this is another really good example of a complicated situation that could have gotten bad pretty fast. So what happened was, this was a different employer story, but six employees all shared a manufactured home. It was on the farm, it was owned by the employer. So one employee had really a lot of symptoms, not just a headache, but they had the dry cough, they were losing their sense of smell. So it looked a lot like COVID. So what happened was that employee got immediately transported to a hotel room that was specifically reserved for quarantining. The other 5 workers were all exposed because they had been living with this individual. So the house got sanitized and cleaned. Those employees had to stay there on paid sick leave again until they could be tested. They weren't allowed to go and work with other crews because sharing a house is pretty high risk. And so if any of those other guys had been positive and then got sent to another crew, that puts the whole crew at risk. So those folks stayed there until they could get tested. All 6 of those employees were tested, and the one that was symptomatic was positive. So what happened at that point was the HR folks talked to that positive case, and they started figuring out who their close contacts were. And they got those individuals tested as well. So they did a little bit of on-farm contact tracing, and we'll talk a little bit more about what a close contact is. Go ahead, Whitney. So a great thing the employer did here was, with this person that was positive, is they had already established a relationship with the county health department and the Growers Association, and they worked together to keep that positive individual in that hotel room. And then the county was providing 3 meals a day. They were providing a healthcare service provider visit every day, so that worker was checked on. And then they also had prearranged a COVID-ready taxi to take that sick worker from the farm to the reserved hotel room so that no other farm employees had to be exposed. HR continued to check on this individual in quarantine. They brought the paycheck, they helped do a money wiring transfer to her family in Mexico and other supplies that she needed. So they did another great job of this. They handled it very well in terms of making sure that person who was positive, was taken care of, and making sure that nobody else was going to test positive or be exposed. Go ahead, Whitney. So there's two sticky points that I've seen with a lot of growers. And one issue is, what really is a close contact? And then this whole idea of 6 feet apart. So I wanted to just dive into that for a little bit of time here. The CDC definition of a close contact is being within 6 feet of an infected individual for 15 minutes or more within this 2-day window before they have symptoms or when they have symptoms. I think that definition is really hard to kind of visualize what that looks like in real life or on the farm. It's hard to understand what that really means. So Ag Socio, one of the employers that we've talked to a lot, they came up with this I think, a really good operational definition. And so they said that for their crews, this is what they were going to count as a close contact. So that was sharing a house with an infected individual, that was sharing transportation with an infected individual, that was working outdoors with them, 6 feet or closer for 15 minutes or more. It was working indoors with that positive individual or that infected individual for 15 minutes or more, no matter how far apart, if they were inside. Any kind of direct physical contact, like a hug or handshake with that infected individual. And then if they had shared a water bottle or eating utensils with that infected individual. So you can see this kind of lays it out, really covers every kind of scenario, and it helps you figure out, once you have somebody that's positive, it's really going to help you narrow down who else needs to be tested and potentially isolated on the farm so that you can, prevent outbreaks. And this is where I've seen a lot of breakdowns happen on farms, is that there isn't a good understanding of who was a close contact or who was exposed. And those people get out, they get mixed into other crews, they get mixed into other housing, and you can have outbreaks for months going on if that's happening. And it just really hurts the productivity of the farm. Go ahead, Whitney. Okay. So the other thing is, why 6 feet? I think this also gets sticky for everybody on the farm, because it is complicated. You're always moving when you're doing field work. And it's just kind of, I think people sometimes need a little more information to understand why we're being told to stay 6 feet apart or more. Excuse me. So the reasoning behind that is because past research has shown that about 90% of the respiratory droplets you sneeze or cough or speak out travel 5.5 feet or less away from you. But 10% of those droplets can go further, and sometimes much further, depending on the wind or the ventilation in the room and things like that. So, public health officials have used that rule. They've decided to say, all right, if we're 6 feet apart, that's going to cover, that's going to cover most of it. That's going to lower your risk. And especially if you're wearing a mask, you should be good in most cases. This can kind of break down though sometimes, especially if you're indoors, because we do know that the risk of transmission is so much higher indoors. So if you have a packing house on your farm, protocols have to be extremely strict in there, because it is a much higher risk for folks when the same air is circulating and they're sharing that air. This chart here, I think is a really great resource. I have the source link down there. But this chart is so good, and it may be good to go over it with your managers or your crew leaders, because it really helps you understand these different scenarios and what the risk is. So you'll see these green, yellow, and red bars. And the basic assumption of all these different scenarios is that everyone in the work group does not have any symptoms of COVID, and that everyone is standing 6 feet apart. Okay, so let's look at this one, low occupancy. So this would be, they didn't put a hard definition on this, but this, just say it's a small group of people, maybe 10 people. And you can see that it has different scenarios. So wearing masks, but they're together, for a prolonged period of time. And then it breaks it down by if they're not speaking, if they are speaking, or if they're shouting or singing. Outdoors, indoors, or indoors and poorly ventilated, what the risk looks like. So this is really good because, maybe not many epidemiologists will say that, but I think on the farm, we know that sometimes wearing a mask is not feasible. You guys are at a high altitude. It might get hot. The physical labor is, that level of physical labor is high. So wearing a mask might be really difficult at times, and it might even be dangerous in certain scenarios. And so you can use this tool to figure out what's going to be risky or not. When are those situations permissible? So you can see here, no face coverings, contact for a long time. If folks are quiet, and especially if they're spaced out even further than 6 feet, say 10 or 12 feet, then you're probably going to be okay, as long as workers aren't bottlenecking and things like that. But you can see here, if you're in a poorly ventilated space, it's not going to be okay. It's not acceptable to not wear masks. So just use this as a guide, because we do want everybody to wear masks, but we know that with outdoor workers, sometimes it just doesn't happen. So this can be a good guide for thinking through that and for thinking, you know, higher spacing levels if needed. Go ahead, Whitney. So you can see here, this is an example of what not to do. Okay, there's no barriers between workers. They're very close. Not everyone is wearing a mask. This is a very risky scenario, even though we're outside. So you do not want this type of situation to be happening on the farm. Go ahead, Whitney. Here's an example where they couldn't maybe space workers out quite as far as they may have liked. So they decided to put up these plastic barriers. This is, you know, a form of an engineering control so that if the worker sneezes or coughs, it's not going to hit the worker in front of them or behind them. So we have this actual physical barrier to stop those respiratory secretions. Go ahead, Whitney. Here's an example, you know, without an engineering control. You can see here that people are, you know, spaced pretty far apart. You would probably want to make sure that folks have their backs to each other. It would be even better if they were staggered. You know, you can have a crew leader kind of monitoring that situation and making sure that people are staggering themselves. And then, you know, up here where they're collecting the squash, this is a potential bottleneck situation. So these guys on the van, you know, if you're not wearing a mask, if folks are not wearing a mask because it's too hot outside, these guys need to make sure that people aren't all going up at the same time to deliver the squash. They need to be calling out, hey, you know, you got to stay back a little bit. So that just kind of gives you an idea of some practical situations to help lower the risk for everybody, even if you can't fully adhere to the PPE recommendations. Go ahead, Whitney. I think that's my last slide. So yeah, I'm going to pass it off to Whitney now. She's going to talk more about the vaccines.
Thanks, Bethany. Bethany covered a lot of great best practices there. And certainly these are tools that you're going to want to continue to use. But one of the new tools that we have in our tool belt in combating COVID-19 is now the vaccine. So I wanted to share information on the vaccines that are currently available, what vaccine distribution looks like in Colorado, and what that means for you, not only for yourself and your family, but also for your employees and seeking vaccination for them as well. So at the time we're recording this, there are right now 2 vaccines that have been approved by the FDA here in the United States, the Moderna and the Pfizer vaccines. So I'm going to talk about those 2. Some key facts for you is that those vaccines have been rigorously tested, despite the fact that it seems like they were quickly developed. And so it's important to keep in mind that one of the things that helps clinical trials, that testing and safety and effectiveness, that process is having people participate. And we're in a global worldwide pandemic. And so finding tens of thousands of people who could potentially be affected to test to see if it worked, that was a lot easier this go around. Our US government and governments around the world also provided a lot of funding and public-private partnerships to make this process go faster and remove some of the administrative and bureaucratic steps without sacrificing the safety elements of it. So both of the currently approved vaccines right now, the Moderna and Pfizer vaccines are based in mRNA technology. And this is not new in that it's had biomedical applications before, but these are the first vaccines that have been made with this technology. So one difference compared to some other vaccines is that it contains no live virus at all. There's no active coronavirus in them. And so they cannot cause COVID-19 in the recipient of the vaccine. What does happen is that it triggers an immune response, things like headache, fever, fatigue, things that look like COVID illness, but are not COVID illness. It's just your immune system kicking into gear, putting the gas pedal down, if you will. Finally, these vaccines, the mRNA does not impact your cells or your DNA at all. So there are some things out there, some myths that this vaccine can change your DNA or it can cause infertility in women. All of those things are myths because it is not interacting with your cell's DNA at all. So in Colorado, this chart that I have up is the Colorado Department of Public Health and Environment's phase delivery chart for our state. So right now we're on the left side in phase 1B. You'll see there's a dotted line. And we are currently above that dotted line. So anyone above that dotted line can get vaccinated at this time. So that includes anyone who is 70 or older, regardless of their occupation. So if that's you, if that's your family members, if that's your neighbors, if that's anyone you work for, you can go online now and look for where to get an appointment and try to make an appointment for yourself or whoever that person is. You'll notice that immediately below the dotted line is a group of frontline essential workers that includes ag and food workers. And CDPHE, the Department of Public Health and Environment, estimates that that line is going to drop down and that vaccines will become available for food and ag workers starting on March 1st, so very soon. We will provide an update in the live Q&A if that changes, so that you have the most accurate date. But at that time, as of now, that date is estimated to be March 1st. So when can you or your employees get the vaccine? Well, if you're over 70, now. And then again, it's March 1st that we're estimating, the state is estimating that anyone who works in food and ag under 70 is eligible. Obvious next question, where will I get vaccinated? So the state has put forward this chart and the state is coordinating, but the actual shots in the arm are coming down at the county level. So you're going to want to look for county specific information. And if one of the two places that you want to bookmark websites is the first link I've provided there, it's Colorado's COVID-19 website with the tab, where can I get vaccinated? And we'll provide a resource. There's a downloadable resource that's going to be available for you through the conference site to have all these links. But that lists every single county's spots that are giving out the vaccine at the current time. The other place that you're going to want to look for is your local county health department's website. That's where the actual vaccines are coming from, is through each individual county. So I'm in Larimer County, so I would want to look up the Larimer County Public Health Department and bookmark that page and their information, because that's going to tell me in my county, where can I go, when can I expect to get appointments, and all of that information. The CDPHE website for the vaccine in general, I've put on this page because there are a ton of resources there, FAQs about when and where and how and why, and how things are working in the state of Colorado. And again, they're putting out estimated dates. And so it's good to go back and check frequently to make sure that things haven't changed. Or if they have, you know what to expect. So talking into the nitty-gritty of actually getting the vaccine. So you can't force anyone to get the vaccine. Obviously, you can't hold them down and stick the needle in their arm. You can ask employees for proof of vaccination. Everyone who's vaccinated in the United States should receive this COVID-19 vaccination record card that's on the photo in the slide. You can ask for a copy of that, and you can keep that in a file that's separate from their personnel file. Bethany talked about in some of her case studies where the HR folks at some of those farms were recording where the testing dates were and their testing results. All of that medical information, quasi-medical information, will be kept separately from their personnel file. So remember that. It's best to ask for that card because you don't want any other medical information from them. You don't want to be responsible for that. And you don't want to unknowingly be given information that reveals any disability status or anything like that. So just ask for that card. Can you mandate the vaccine? Can you require someone to have the vaccine as a condition of employment? So the state of Colorado is not pursuing that route. And it is likely that you could do that, though not many people are recommending it. And if you do that, you definitely want to consult with an attorney. And I think many of us would recommend that this is not your best strategy, and we're going to talk about that here next. So if you're thinking about mandating, I want you to remember that you have a responsibility in protecting the medical information of people, and protecting their medical information and their disability status. So if you're going to be requiring different things and requiring this sort of vaccination, that's something to keep in mind. Also consider that you probably have tools and things that you can do to strongly encourage someone without having to mandate it. So you can use the carrot instead of the stick. And I think maybe most importantly is to keep in mind that your employees might have concerns or might be hesitant about the vaccine. And so how can forcing them to do something without properly educating them first, how that potentially could disrupt some of the trust that you're trying to develop between your crews and yourself or your managers. So specifically for farm workers, I wanted to show you some data from a survey that some colleagues in California did early in the pandemic. This was earlier this last summer, I guess. But they asked farm workers in the Salinas Valley of California, about 1,000 workers participated in this study, if when the vaccine becomes available, would they be likely to go get it? Would they want to receive it? Most, 70%, indicated that yes, I would like to get that vaccine. Of those who said no or I don't know, the number one reason of why they were hesitant or reluctant, you can see from this chart, is side effects. Is what's going to happen to me afterwards. And that's a really common, what we would call in the public health world, vaccine hesitancy or vaccine reluctance response, is I'm just unsure of what's going to happen to me, to my body, when I receive that vaccine. Some other concerns that are top, afraid of getting COVID, which we just talked about. That's why I shared that key fact that these vaccines cannot give you COVID. They can boost an immune response that looks kind of like COVID, but is itself not COVID. Another big one is they don't trust the government. So this is that trust piece, right? We're putting ourselves in someone else's hand and having a foreign thing injected into our bodies. And that does require a lot of trust. And I think some of us are willing and have good experience with the government to say, yeah, I trust that this is going to be good for me, and trust that the leaders who developed this have my best interests in mind. But keep in mind that you might have workers who are from foreign countries who aren't as familiar with our government or have been otherwise isolated or had negative experiences that might make them reluctant. So one of the key things that you can do then to encourage your employees to get the vaccine, and your family and your friends and yourself, is to have a realistic expectation of what the side effects are. And so this is a nice graphic that I've pulled from the Oklahoma City County Health Department, but they've put in pictures what to expect. And one of them is tiredness, pain or swelling at the injection site. I'm one of those people who always has a stiff arm after getting the flu vaccine, so it'd be something similar to that. You might have fever or chills, or you might have a headache. A family friend of mine who works at a hospital, she got her second dose of the vaccine yesterday, and I heard from her this morning that she's really not feeling great, but that's to be expected. And so she's not worried because she was expecting it. And then obviously the next question is, well, when is it worrisome? And so you want to worry if it's lasting a prolonged period of time, so more than 2 to 3 days, or if the farther you're getting from your injection, it's getting worse and not resolving or getting better. So like I said, this is what CDC says. They say that the mild side effects may appear 1 to 3 days after vaccination, and those side effects could last 1 to 2 days. And again, when we're talking about, well, how does that compare to getting COVID? There are people who have fever for 10, 14 days, who have really prolonged shortness of breath. So, being tired, being a little fatigued for a day, surely will be better than suffering COVID for multiple days. Two really important things to note about the side effects is that they're more pronounced after the second dose. And here I'm talking about the two vaccines that we have available are both 2-dose vaccines at the time of recording this. There is one that's in discussion right now, the Johnson & Johnson vaccine. And I don't know at this time right now, sort of if these side effects are the same or how to set expectations for that vaccine. The other important thing to note is that these immune responses are more pronounced in young people because we have better immune systems. It's just kind of the matter of fact way of putting it. And so our immune systems are, putting the gas pedal down and producing those antibodies. And so chances are your crew is younger. And so this is something you are going to have to consider and deal with. So to mitigate the impacts of this, a few things that you could consider. One would be vaccinating before an off day or providing paid sick time. So the 24 hours, especially after their second shot, they don't have to worry about missing work or not trying to push through anything, that they have the comfort and the knowledge of knowing that they'll be able to relax and expect that these things could happen. Also, because of that, you don't want to vaccinate everyone on the same day. If you have 30 crew members, you vaccinate them all on the same day and 15 of them have a really debilitating headache the day after, you don't want to work with half your crew, right? So if you can rotate through and that way you have continuity in your staffing. Also, know what medical provider you're going to contact if people have questions or if people do feel bad. Specifically, if you have workers who speak Spanish, know where you can direct them to a healthcare provider who can provide answers to their questions in Spanish. I think for me, the bottom line of this question of do I mandate or not would be no. You don't need to mandate, but you can do the best you can to facilitate access to the vaccine. So you can educate employees, you can provide accurate information in the appropriate language. I think that's pretty straightforward, but it's worth saying. Set realistic expectations on what to expect after vaccination. I just gave you an example of how to do that, of showing you those pictures of what to expect, telling you about my family and my friends who've experienced it, normalizing it as much as possible, telling them that these people are all okay, and that they benefited from maybe one day not feeling good to have this vaccine and to strengthen their ability to either not get COVID or have a very mild case of COVID in the future if that should happen. Another thing that you can do is partner with other growers in your area, partner with local health providers. If you don't have connections with your local county public health department or local migrant health centers, now is the time to do that, right? If you have a group of growers in your area and you know that your packing house parking lot is a big area and you call your local public health department and you say, we've got 4 growers who can rotate through our employees. If you're willing to come and set up a clinic in our parking lot, we can facilitate the efficient vaccination over 4 days of all of our employees. And so working on those partnerships now, even before March 1st, will help you potentially get vaccines or help your public health department know, your local healthcare providers know that you're ready to go. And then finally, it's support. We mentioned already providing time off after they get the vaccine, paid time off so that if they experience any side effects, they don't have to worry about missing work or missing that money. I also want to talk about potentially any administrative costs to the vaccine. So in theory, the vaccine is free to any person living or working in the United States. The vaccine is free to them. Some healthcare providers might charge an administrative fee on their end, but there are ways you can find money and grant dollars to support that. So that's something you can do. Or, if you know that transportation is the issue, can you provide the transportation to break down the barriers? What barriers might your workers face in getting access to the vaccine, and how can you help support them to remove those barriers? I do also want to mention, just in the last 24 hours or so, there's been a lot of warnings coming out across the state and the country about vaccine scams. Unfortunately, there are people who want to take advantage of our willingness and our hope and desires to get vaccinated as quickly as possible. So even though I mentioned there might be an administrative fee from your healthcare provider, they should not ask for that upfront. So if someone calls you or your employees and says, if you pay me $50, I'll get you to the front of the line, that's a scam. So anyone who's asking for prepayment, anyone who's telling you they can get you to the line faster, anyone who's demanding personal information or personal medical information from you before getting the vaccine, all of that is scams, is phishing, it's spamming, and you do not want to give out any of that information or pay anyone before you've received the vaccine. So as we close out, I wanted to name some specific resources for you. Again, there is a handout available for you in the conference site that has the links that we've talked about, some of the things that we've referenced, like the CDC checklist. There's a Colorado specific checklist. So you don't have to worry to rush and write down any of these websites. They will be available for you after the fact. But a few key ones to mention. High Cause, the organization I'm with, we have a COVID-19 page that helps walk you through some of the different sections of the CDC guidance, has updated COVID vaccine information on it, and just we really tried to pull together where resources already exist and put them in one place for you so you can go through and find what you need. A really great resource for us in Colorado is the Osha Consultation program. So this is run through Colorado State University, and they are they are not OSHA, they don't work for OSHA directly. They're health and safety professionals who will come in and consult with you on OSHA protocols. Many times this is free. And right now they are doing the appointments virtually. So they'll do it over Zoom. You take your phone and they'll walk through with you through your farm, through your processing house, and help you either look at a specific area or a specific topic in terms of safety and health that you are concerned about, or they'll do something more general. Many of you have probably already accessed the resources from the Produce Safety Collaborative. CFVGA, Western Growers, other grower organizations are also providing a lot of information. And then Equitable Food Initiative, or EFI, it's a farm certification program that works on providing assurances on employee welfare. And they have a lot of great resources, including a really nice menu from their growers, these sort of manager, worker generated ideas, best practices that have worked. And these are produce growers. So I would highly recommend that you go check out that site so you don't take our word for it, but you can hear it from your peers. Bethany's organization, the National Center for Farmworker Health, has some really great resources, especially Spanish language resources. Your migrant health centers, there are 6 in Colorado, places like Salud Health, Valleywide. If you don't have contacts there, you should be starting that now. Many of them provide a mobile service so that you could do clinics and other immunizations, other health care for your employees on site, or it's low cost and in many times in Spanish as well. And then finally, there's a Mexican consulate in Denver, and they do provide some services as well. And remember, certainly if you have H-2A employees from Mexico, they're a resource, but they serve anyone who is a Mexican citizen. So they don't have to be H-2A workers. Anyone who is a Mexican national can get resources, and they're there to help at the Mexican consulate. So final thoughts, Bethany, I'm going to open this to you too if you have any before we join you at the live Q&A here in a few minutes. Our take-home points are: start now. If you haven't started planning already for the season, do it now. Find your protocols, build that worker health and safety team. Be looking into where can you get vaccinated? Where can you get vaccinated? Where can your team get vaccinated? So when that March 1st date rolls around, you're ready to go. And finally, plan out resources. What items do you know you'll need for the whole year? What plans do you have to secure some of that now, secure some of that later? And plan for your protocols to be in place for all of 2021. I know that is really a bummer to hear. We're all looking forward to the vaccine and that sort of return to normal. But if you set a realistic expectation that you're going to need to do this all year, that makes it easier, and you're not disappointed if things continue to drag on. And then finally, I think most importantly is that this comes down to leadership, communication, and mutual respect. I think Bethany, the case studies that she represented, and the care and the trust and the mutual respect that those businesses showed to their employees and making sure that their welfare was cared for, speaks volumes to me, at least, in their success. And, you know, I think a lot of people want to say, well, all of this is great, but I can only do what I can for my employees when they're on the work site. And that's true, right? But if you demonstrate that you are doing the best you can and that you're working together to protect them while they're on the job, and you ask of them to do the same when they're at home, you've set up a two-way street, and they'll do what they can. Bethany, do you have any other final comments?
Yeah, thank you, Whitney. Just one final comment. You know, I talked to one farmer not long ago, a berry farmer that had hired 1,000 H2A workers last year. They only had 9 positive COVID cases among the 1,000 for the whole year, and that was despite pretty extensive testing. You know, and it was because they implemented so many protocols. It wasn't cheap to implement all of that. And they certainly did have to slow down a bit, but they never had to stop the operation completely. Whereas I've seen another farm that had a similar number of employees. They had 4 employees die, and they had outbreaks going on from May to October last year. So it is expensive to put in these protocols. We know it's not cheap, but in the long run, it's going to save everybody time and money.
Want to say thank you for joining us, for taking the time to be here, and for showing your commitment to this topic and to your employees. And we're excited to talk with you on Q&A. We'll give any updates. We know things are changing, so we'll bring forward some maybe new timing stuff, and happy to answer any of your questions then. Adrian,
excellent, informative presentation. Thank you so much, viewers. Before you leave, and again, thanks to Whitney Pennington and Bethany Alcalter. For viewers, next step, this is important. Please complete the brief session evaluation on the evaluation tab above this window in Feedloop. Where you're viewing this, click on the other tab. You'll see a evaluation you can click into, multiple choice, very short, will help us out a lot. Please do that. The live Q&A that Whitney's mentioned, following this, scroll down in Feedloop and you'll find a section called Additional Sessions. And you're gonna click on that to launch Zoom. Zoom is going to open external to Feedloop, open a webinar, and we'll conduct that webinar in Zoom fashion you've seen before. You'll type in your questions for Bethany and Whitney, and we're excited to have you. So we'll see you there next. Thank you.